From ABC7, this is Eyewitness News.
Coming up here, a medical breakthrough when it comes to concussions.
Up next, the new test available only in Southern California that can help determine if a young athlete is ready to go back on the field. For doctors, treating and evaluating a concussion is complicated. Symptoms and reactions vary from person to person.
Finding a definitive way to diagnose it is key. And now some local doctors have a new tool to help patients get back in the game. Health specialist Denise Dedore shows us how it works. Denise.
Yes, it's very telling technology. If someone appears to have a concussion, doctors have to make a diagnosis based on symptoms and how well a patient does on a neurological exam. MRIs don't always tell the whole story. Now researchers say brain waves may provide an accurate way for doctors to measure a concussion. Heading the ball is part of the game, but it can be dangerous. 18-year-old Emily Carmen plays for Loyola Marymount University.
I was playing in a soccer game on September 4th, and I got kicked in the head by a cleat.
Right after, she started feeling
dizzy and woozy, kind of, and my teammates told me I was acting weird, and I really didn't remember what was happening.
Before her season started, Emily's neurologist, Dr. Vernon Williams at the Curlin-Job Center, did a baseline assessment of her brain's various functions using a test called brain network activation.
We can identify networks associated with attention, and we can identify networks associated with working memory.
How well Emily's brain performs in these areas provide doctors with biomarkers to assess her injury.
And we can compare those networks in an individual who suffered a concussion with a normal network.
What experts say is most promising about brain network activation is that it can provide doctors with a roadmap as to when it's safe to return to play.
In the past, I couldn't continue playing soccer or anything until my symptoms went completely away.
Sitting out a game is one of the hardest things to do for an athlete. Dr. Williams says even though Emily still has a few symptoms, he's clearing her to play because her test shows her brain functions are normal. Studies show this can actually help with healing.
Activating the brain at some degree of physical exertion may be beneficial, not in the acute phase, not immediately after the concussion, but over the next days to weeks.
Dr. Williams expects more doctors will be using this technology.
It just provides another objective tool in this concussion management strategy.
Dr. Williams says with all the concern about concussions in the major leagues, brain network activation can also be helpful in treating and following players in the NFL. He's performed many baselines himself on local professional athletes. And this patient, Emily, she actually did better on her test after the concussion.
Wow, that's fantastic.
Yes.
Kicked in the head with cleats. That's
I know.
brutal.
It is.
Denise, thank you.